Hello everyone, this is going to be a medical question and answer series that I'm going to start. And this is Med Made Easy Medical Channel, and I want to go ahead and jump right into the question. Typical absence seizures. Which of the following is false? You can look at these answers here below, and I want you to comment which one you think it is, but let's go ahead and jump right into reading them. Number 1, it begins with both sides of the brain. Number 2, they typically last 5 to 10 minutes each. Number 3, the person may have a blank look or stare. And number 4, when the absence seizure ends, the individual usually resumes normal activity. What do you think the answer is? Let's jump right into the answer. If you guessed number 2, you are correct. Absence seizures typically last anywhere from 5 to 10 seconds versus minutes. Even though an individual may have recurrent and repeated absence seizures, they typically last only about 5 to 10 seconds. There's another type of absence seizures which is called atypical, which do last a little bit longer than the typical ones, so they can last anywhere from 20 seconds or more, but typically that's the average. So even though an individual can have anywhere from 10 to 50 or more absence seizures a day, they only typically last about 5 to 10 seconds each. Let's jump into talking about the other answers here, the true answers. Number 1 begins with both sides of the brain. An absence seizure is obviously a seizure that we know that seizures cause abnormal brain activity. It's not really known the exact cause for absence seizures, but it is diagnosed with an EEG test. Number 3, person may have a blank look or stare. This is sometimes called, people will note this as staring spells at the individual. It's most often in children from the ages of 4 years old to 14. Sometimes these individuals will actually have some incontinence, so they'll lose bladder control during the seizure. And these individuals, their eyes may turn upward, they may have fluttering of eyelids, they may even have some smacking of their lips. They usually are very still and they don't speak. It may appear that they're daydreaming. This can happen any time of the day, and it's not brought on by boredom. And usually these individuals are going to stop all activity. Number 4, when the absence seizure ends, they usually resume all activity. And this is true. They may, whereas most seizures, the individual often is very lethargic, very fatigued and tired. These individuals often can resume their activity that they were doing prior to the absence seizure. And the only difference is, I guess you could say, is that they often will feel a little bit off track. They may feel like they are a little bit confused or they lost track of time, but they're usually able to resume activity. Well, if you like these kind of videos, make sure to thumbs up this video and also put in the comments what you like about these kind of videos and also topics that you would like to have questions on in the future. Make sure to subscribe to our channel.